This is our psychological analysis of Thomas Buchanan by Savannah Farrick and Ethan Bright. We're here today to evaluate the mental state of Thomas Buchanan, a 30-year-old white married male currently living in the West Egg. He was brought into Bellevue on September 19, 1922 by his wife Daisy Buchanan. Mr. Buchanan received 17 years of formal education, including 4 years of college at Yale. Shortly following the murder of Jay Gatsby, the Buchanans left to get away from the scene. Months later, upon their return, concerned Daisy brought Tom in after hearing rumors about his potential part in Gatsby's death. Miss Buchanan recounted the explosive behavior, a decrease in patience, and an increase in irritability in Tom leading up to Gatsby's death. What raised the biggest red flag, according to Daisy, was an altercation that occurred at a suite in the Plaza Hotel. Tom was reportedly short-tempered and belligerent and is suspected to have a psychological issue regarding anger and emotional distress. Going on to the assessment procedures, Mr. Buchanan's psychological examination took place over a period of 2 days and lasted approximately 4 hours. During this time, the following tests and interviews were administered, including an intake interview, a Level 1 cross-cutting measure, 2 Level 2 cross-cutting measures, and a diagnostic interview for genetic studies. Moving on to the background information. The majority of background information that we received from Mr. Buchanan came from his original intake interview and the diagnostic interview that we administered lately. These interviews were recorded and the relevant information is as follows. Hello, Mr. Buchanan. If you have any symptoms, how would you describe them and when did they first appear?
I would say people tend to get on my nerves frequently. I think I first started noticing how much people were annoying me during college.
What do you think is important to know about you?
I think I'm the best and the only thing that matters. I tend to get angry when people don't do what I want them to, especially if they're a woman, and I may even become violent with them to put them back in their place, which is, of course, far beneath me.
What is your prior mental health history?
I have not been diagnosed before.
Have you had any current or prior thoughts of hurting someone else?
I have on rare occasions felt compelled to hurt people when they've annoyed me.
Do any of your immediate family members have a history of mental health issues?
My father was thought to have intermittent explosive disorder.
Have you been married, and if so, for how long?
3 years.
Do you have any children? What is your relationship with the children?
I'm the father to my one daughter.
Has anyone in your life expressed concern regarding use of substances?
My wife has warned me to limit my drinking.
Do you have any current or prior history of substance use?
I began using alcohol at the age of 20, and the last time I used it was yesterday. I began using tobacco at the age of 19, and the last time I used it was earlier today.
What has been your longest period of sobriety? What are the triggers for relapse?
I have not gone over a week without tobacco or alcohol for as long as I can remember. They help when I'm stressed.
Is there anything we haven't talked about that is relevant or important, or that you feel I should know about?
I played a part in Jay Gatsby's death by telling George Wilson where he lived and that he was the owner of the yellow car that hit Wilson's wife. Although he did not directly tell me he planned to kill the owner of the car, he was carrying a gun, so it wasn't difficult to put together. But this didn't stop me because I felt like Gatsby had it coming, as he killed Myrtle and tried to take Daisy away from me. Also, I was having an affair with Myrtle, which to me made her death very upsetting and cemented the thought that Gatsby deserved to die.
Once we had the background information on Mr. Buchanan, we moved on to assessing him. Once we got Mr. Buchanan into our system, we began to ask a series of questions to help zero in on his mental issues. From this preliminary examination, I concluded that Tom may suffer from anger management issues and frequent manic episodes. To corroborate this, I placed him under additional testing so that I could determine the severity of these issues. During these tests, Mr. Buchanan revealed that he often felt angry or annoyed and always felt grouchy and ready to explode, which suggests that he has severe anger issues. He also expressed many symptoms of a severe manic condition, including feeling extremely self-confident and engaging in more risky activities than usual. personality inventory that I had Tom fill out to determine which disorder-related personality traits he possesses also confirmed my suspicions. His results clearly show that he has problems with grandiosity, hostility, impulsivity, risk-taking, callousness, deceitfulness, and irresponsibility. All of these traits often align with manic episodes and frequent angry outbursts. After consulting the DSM-5, we've come to determine that Tom has both intermittent explosive disorder and oppositional defiant disorder. The symptoms for IED are recurrent behavioral outbursts representing a failure to control aggressive impulses as manifested by either of the following: verbal aggression, or 3 behavioral outbursts involving damage or destruction of property, and/or physical assault involving physical injury against animals or other individuals occurring within a 12-month period. The other symptoms are the magnitude of aggressiveness expressed during the recurrent outburst is grossly out of proportion to the provocation or to any precipitating psychosocial stressors. The recurrent aggressive outbursts are not premeditated. The recurrent aggressive outbursts cause either marked distress in the individual or impairment in occupational or interpersonal functioning. The chronological age is at least 6 years. The recurrent aggressive outbursts are not better explained by any other mental disorder. The symptoms for oppositional defiant disorder are a pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories: often losing a temper, often touchy or easily annoyed, often angry and resentful, often argues with authority figures or for children and adolescents with adults, often actively defies or refuses to comply with requests, often deliberately annoys others, often blames others for his or her mistakes or misbehavior, and has been spiteful or vindictive at least twice within the past 6 months. The final symptoms are the disturbance in behavior is associated with distress in the individual or others in his or her immediate social context, or it impacts negatively on social, educational, occupational, or other important areas of functioning. And finally, the behaviors do not occur exclusively during the course of a psychotic, substance use, depressive, or bipolar disorder. Also, the criteria are not met for disruptive mood dysregulation disorder. Because Tom exhibits all of the symptoms for both of these disorders, we firmly believe that he has both intermittent explosive disorder and oppositional defiant disorder. This concludes Thomas Buchanan's psychological analysis. As far as treatment goes, I would recommend... Tom, how did you get in here? Wait, what are you doing? Tom, no, stop, please, I have children!